You know, if I step back, my grandfather came from Italy in 1922, and probably, as you know, from seeing the commercials. And I've been very lucky. I've been part of the American dream. You know, they promoted education, and I had a very nice life. I grew up in a middle-class family, and my father went to school.
Well, let me jump into the question about health care reform, health insurance reform, that sort of starts here in Massachusetts. Our local hospitals, particularly Quincy Medical Center, is filing suit because since Massachusetts has developed a universal health care plan, they have lost close to $23 million because of the fixed percentage of reimbursement that the plan provides for them, and because they deal with a large number of indigent or Medicaid patients. The chairman of that hospital took a look at what the House passed, the Senator Kennedy much touted health care plan, and said, if this happens, we're out of business. Not only will the state plan kill us, the federal plan will. It was not health care reform, it was health insurance reform. I assume you've looked at that plan and you've looked at the Massachusetts plan.
Yes.
What do you have to say? How do you speak to him?
And so they're more Medicare, Medicaid
yes.
mix. So that, okay, so I understand the situation now. So that's a hospital. I think the hospital term for that is they call it, quality mix, private pay versus Medicare, Medicaid.
Mm-hmm.
And if you get skewed toward Medicare, Medicaid,
right,
it's a lot harder to make a profit because those rates are 30, or break even, because those rates are 30 or 40% less.
Yes.
And on top of that, you still have to pay for indigent patients, even the system that we have today. People who don't have coverage, you're paying for them. So, how do you solve that? I think he has a legitimate question, and that question has to be solved by what are the rates that people are paid, and how do you run a hospital efficiency with those rates? So, he's got to look at what his procedures are. I'm assuming he's probably not doing some of the procedures that give profit to Mass General and the other hospitals as well. So let's talk about his hospital. His hospital sounds like it has a mix of services that they're just overweighted in patients that get discounts on the type of care that they get. I guess the answer to the question is I'd have to study that hospital and say, okay, what could that hospital do under today and to change regulations to generate the revenue to break even?
I saw a statement clarifying your remarks this morning on the radio
yes.
show. Can you, for everyone, explain exactly what your comments were meant to mean in regards to military draft, and then also comment on, sort of where you stand on taking troops out of Afghanistan?
Yeah, I misinterpreted the question. I got the question first, and it had a preamble to it that there are 200,000 people and they're in Iraq, and so the way I heard the question, which could have been totally wrong, was if we were short on troops and we had no troops, how would we get troops? And I immediately went to a kind of, in my mind, a fairness process. So if we had to, there was no way to get troops. That's how I interpreted that question. So I misinterpreted the question. So my answer was, if we didn't have troops, we couldn't get them out of the way. We'd have to have a draft. I want the draft to be fair. And I went back to my days, in my mind, even went back to my days at Vietnam, where I missed the war by about 6 months, but I was on a draft list. And I thought it was very unfair that people would get out in college exemptions and all the rest. So I thought it was a fairness question, not a draft question. And so I support the voluntary Army. I don't support a draft. I don't think we need a draft.
In terms of Afghanistan, what I know you said that in terms of the mission is complete. What role does the United States have in terms of, or the coalition have in terms of restraining the Taliban? And what do you think should be done? Whether we have troops there, whether we have other kind of means. What's our responsibility?
Well, I'm a strong believer in counterterrorism, which means where specific threats pop up, we have to respond to those threats. So history tells us that it is very, very difficult to send any number of troops in, no matter how big the number is, to kind of nation build and straighten out these countries. So my strategy is, get our troops back here safely.
You have said in these ads that the ultimate goal is that the needs of the 36 million people without insurance supersede the impingement on the abortion question. Is there anything that this bill might include that will prevent you from voting on it, or voting in favor of it?
It's unfair what's going on now to women. They should have the rights, reproductive rights. They should have free choice. It should be paid for as part of the health plan. So my comment is, to me, this is a debate about, do we want to finally make some progress after 50-something years of not making progress on getting every American covered by health care? It's a life and death issue to many Americans. We have to get it done. Republicans put that thing in the bill and probably derail the whole process. We can't have the process derailed. I want to deal with it within the bill and get the bill done, so it doesn't have an end. If it remains in the bill, I would still vote for the bill.